All right, judgmentalism. This one is really profound. And I think when you get the essence of this, you understand what I'm talking about. In order to be loved, I must be lovable. When we grow up in an invalidating environment where to be loved means meeting a certain requirement, we grow up requiring that of those that we love. You have to be something for me to be loved, whatever that something is, employed. You have to have your status in the community. You have to be X, Y, or Z other than just what you are yourself in order for me to love you. And when you don't fulfill that, then I no longer love you. Now, this is different from setting healthy boundaries, which we all know, and where safety is involved, or where there's a limit where you say, I won't tolerate abuse. I'm talking about just that where we have relationships that are coming in that are saying, you're not being the defense that I need you to be for me anymore. We were judged, and love was contingent on that judgment, and so therefore we learned to mix it. And as a result, many of our closest relationships get corrupted with that judgmentalism. And it becomes very difficult for us to maintain really fulfilling long-term relationships because we're not okay with ourselves, and therefore we're constantly judging the other person. We're looking through that lens, which is we know that we are fundamentally unlovable, and so we look through that same lens of judgment to the other person, and it makes it difficult to create fulfilling relationships. Love and judgment are married. Love is always contingent on you being lovable, and the world doesn't make sense unless they're good and bad people. Another deficit defense, fantasy. When I'm successful, I will no longer be shameful. Addicted to a fantasy. I remember several years ago working with a client who really, he had struggled on and off with shame and with depression as a result of it, and had done very well. He was a physician and had a fairly successful practice, but that wasn't enough. There was always this need to be doing something more magical, something bigger than. So it wasn't okay just to be an ordinary physician with an ordinary practice. So he, at one point, joined Doctors Without Borders, which is a wonderful organization. Clearly, I think all of us would agree, contributing like that's important. But for him, it had this fantasy element. It was an escape to do this thing that was bigger and broader. And that worked for a little while. And then it didn't work anymore because, as you can imagine, Doctors Without Borders is a very difficult, tedious place to be. It didn't meet the fantasy. And so then there were the trips to Nepal, and then there was getting involved with a particular school of yoga and following the gurus of that around the world. And there was always this bigger than life escape kind of fantasy. I could never accept reality on reality's terms. That's when we see that defense. You can never be here and be now and be okay with it. It's always going to be something bigger, something better. The big win, and my ship will come in and idealize and then devalue. This bottom one's really important to point out, idealize and devalue. Because when they start using this defense, that almost always happens, because this is the new thing, this is great, this is going to be what makes me, this is going to make it all okay, this is going to be the big win that makes all the struggle worth it. And of course, it works for a little while and then it doesn't work, and then they begin to devalue it because it never matches up to the fantasy in their head. It never gives them the relief that they're looking for because they don't have that core of self-validation. It never works. It starts to slide. And so they must devalue. So there's the new thing, the new person, the new teacher, the new whatever it might be, and then it starts to slide down. Living in Santa Fe, New Mexico, any of you that know Santa Fe, by the way, I lived in Santa Fe for about 10 years. Santa Fe has honest to God, it's got every guru on the planet has been there. Really. I mean, and some you've never heard of. And they're all doing, interesting. I've started to say bizarre, that's a little judgment, but wow, really? That's what you do? And people come. I'll say one, and some of you probably love this particular guru, and you're not going to like me after I do this, but that's okay. There's one that all she does is hug. Yeah.
It's a profession.
Yeah, that's all she does. She doesn't talk, she hugs. And people wait hours to be hugged. Which is fascinating to me that, anyway. I saw this a lot with clients, because the other thing about Santa Fe is has a long history of being a playground of the wealthy, and oftentimes, actually many families on the East Coast, their kids would be well off from trust funds and whatever else and end up in Santa Fe, and so they would kind of bounce from one guru to the next. And there was always this idealized, this is going to be nirvana, and then it doesn't happen, and then they would start to devalue it, be very disappointed, and then have to move on to the next guru. And then from there, they moved from Santa Fe to a commune and Taos, and it would just go on and on and on. Okay, another deficit defense attack. I must destroy anyone who exposes my shamefulness. Those of you that work with executives in corporate America, and I started my career out as a psychologist with Hewlett-Packard, this is really prevalent. And it is something of a narcissistic defense, but it is really relevant when it comes to shame-based trauma. And it's very hard for a lot of people to get their hands around it when they see it, because the person who is doing it seems really full of themselves and really in control. But what it comes from is, I am so critical of myself inside that when you offer any shade of criticism, it's too much. And I have to destroy you. I have to pull you out of the position. I have to, you have to be gone from me. And you relate to it. Some of you may have experienced it, but we'll have clients who will say, I don't know what happened. I was doing well. I was like the golden child. Everything was, and all of a sudden, one day I walked in and they wouldn't take my calls, and I couldn't get through. And it switches like that often for them, because the other person, whatever they've done, inadvertently shamed them, showed them some aspect of themselves that they internally felt very flawed about, and they were pushed aside. They couldn't tolerate it. And the ones that have actually done really well often in those organizations or around that particular executive are the ones that are often very skilled at, they have great radar and antenna at picking up on what's going to be shameful. One of my favorite books, it's filled with a lot of psychoanalytic jargon, and I think at this point in time, if we take an evidence-based approach, I wouldn't say this is a great evidence-based book, but it certainly was life-changing for me, which was The Drama of the Gifted Child by Alice Miller. And she talks a lot about narcissism and the children of narcissists, how we develop this exquisite radar as adults. And many of us become therapists, by the way, because we have this great radar, because we can pick up when the winds are shifting, and we can pick up and understand when someone's about to be shamed, and we're very skilled at doing that dance and avoiding it. And it's been something that actually has served me very well, I have to say, in my life, because I've been able to work with folks that others wouldn't work with, because you could pick up and you wouldn't shame them in that aspect. But those that are not savvy to it are usually really taken back when they run into someone that's using this defense. Attack when you feel judged by others. Rage is almost always rooted in the shameful self. And when I'm talking about rage, I'm talking about that kind of anger that's above and beyond. It's almost an anger that's not attached to a target. It is pervasive. And when you see that kind of out-of-control, persistent anger, it's almost always rooted in the injury of the self, the shame. Strike out before others can expose your shamefulness. Okay. A deficit defense of adopt expectations. If I'm to be loved, I must fulfill my parents', my spouse's dreams and expectations of me. Alice Miller, quote from her, many people suffer all their lives from an oppressive feeling of guilt, the sense of not having lived up to their parents' expectations. This feeling is stronger than any intellectual insight that it is not a child's task or duty to satisfy his parents' narcissistic needs. It's always interesting to me how unavailable this often is for our clients, and how prevalent it is, in that they live their lives out living their parents' dream. Maybe not literally, in the terms of maybe they're not, maybe the parent's dream was to become a physician and maybe they don't become a physician. But when you get down to the root of it, they live the life that the parents always wanted to live and couldn't. And they live their life according to their dream. They reach their 40s and 50s, classic midlife crisis kind of thing, where they've lived it, they've adopted the expectations of others, earning validation, and they turn around one day and say, I don't know who I am. And this is not meaningful to me, and I've created all these things, and I've been all these places and done all of this, and it doesn't mean anything to me. And it's often because they're engaging in this particular defense because of the lack of self-validation, living someone else's life, living the life you should live instead of the life that is authentic. Okay. How do you get someone to begin to foster a sense of self who really has no sense of self? How do you put something there when there's no there, right? How do you get this started? And that really becomes the essence of treatment. How do we begin to get that started? Let me tell you, all of us have heard about or practiced or been involved with exposure therapies for trauma, like EMDR, there's somatic sensing, there are other forms of therapy that have become very popular in recent years. Most of them involve, first of all, identifying an incident and then retelling of the incident. And while it's a gross generalization, it's about often reprocessing that incident, right? And so the incident is replayed over and over again until there is no longer that strong emotional attachment to the incident. Now, what is frustrating about this to me is that individuals who've been traumatized by shame are often put through this kind of treatment by their therapists. And it is because that's the only trauma treatment that we know. And we lump them all in that category, and yet they're really, it's not appropriate on several levels. First of all, it's not appropriate because there's usually not an identifiable event. I hope you got it from the first part of this presentation that it's not the hit, usually it's not the sexual abuse, it's the pattern of invalidation, which happens over years and persistently, and so you can't identify that particular point. They don't meet the criteria of PTSD where they're having flashbacks or they're reliving it. They're not intrusive memories. And so often what unskilled therapists will say is that you're in denial about that if they can't access it, and I don't believe that's necessarily the case. I think the difference that we're looking at, and it becomes incredibly relevant in treatment, is that PTSD, post-traumatic stress disorder, is an anxiety-based disorder. It is a disorder of the emotion of fear. Remember the 5 emotions, okay? Shame-based trauma is a disorder of shame, not fear. Shame becomes the primary. And so the treatment model must treat it that way. PTSD, there are some very effective ways for treating that and clearly needed in some clients. And sometimes it's combined with shame-based trauma, so you use traditional trauma methods for that. But when it comes to shame-based trauma, those methods typically don't work. And in fact, they do harm. And again, going back to the Evolution of Psychotherapy conference, it was really a great pleasure to hear Albert Bandura speak. And if any of you have been up on Albert's work of recent years, he's done a lot. You may remember, he's a psychologist that came up with self-efficacy. And it's one of the most rigorous findings in all of psychology. The fact that self-efficacy is the ability to control your own behavior and determine your own life, and how important that is. And one of the things that he's done recently that's kind of gone under the radar but is very significant is that a lot of the traditional trauma treatments actually hurt self-efficacy, coping self-efficacy, because having you replay over and over and over again the incidents reinforces that sense of being out of control and not able to control your life and not able to control what happens to you. And it hurts that ability to feel like you can make a difference in your life, your self-efficacy. And so one of the studies that he presented, which was interesting, is that those who use trauma treatments in combination with a style that supports self-efficacy are very effective. But the ones who use it and don't support self-efficacy often do a lot of damage. So in that context, what I want to tell you is that when we start looking at treating shame-based trauma, self-efficacy becomes huge. It becomes a primary goal. How can we reinforce this sense that you have control over your life, that you can cope, and that you have the ability to handle what comes your way no matter what that is?